Resveratrol is a plant polyphenolic nutrient that possesses both anti-inflammatory and antioxidant properties. For centuries, both the Chinese and Japanese have used resveratrol to treat a variety of ailments. Additionally, many within the scientific community believe that the high resveratrol content of red wine could help explain, at least in part, the French paradox. The French paradox is a phenomenon in which the French have a much higher consumption of animal products and saturated fat, yet have a lower incidence of cardiovascular disease. And many experts believe that the resveratrol that's found in red wine can help explain this observation, at least in part. So how does resveratrol potentially promote musculoskeletal health? There are similar biologic and physiologic processes that drive premature aging of bone, muscle, tendon, and joints. Research suggests oxidative stress, chronic inflammation, and mitochondrial dysfunction all contribute to the unhealthy aging of bone, tendon, muscle, and joint. Oxidative stress occurs when the production of destructive free radicals overwhelms the body's natural defenses. In this scenario, the free radicals roam unfettered, attacking healthy fat, healthy DNA, and healthy proteins. Chronic inflammation occurs when there's an upregulation of certain types of chemicals and enzymes that lead to significant collateral damage to healthy structures. This damage leads to cellular dysfunction and premature aging. Mitochondrial dysfunction can be thought of as one, having a deficiency in the number of mitochondria, and two, having a diminishing quality of mitochondria. Now this has two very important physiologic implications. One, if you have less mitochondria, then your cells are generating less energy because the mitochondria is the main power generator of the cell. And like any type of machine, if you don't have sufficient energy, then you won't perform optimally. And the normal repair and regeneration and growth processes are dysfunctional. Moreover, if you have dysfunctional mitochondria, then the number of free radicals is increased, and these free radicals tend to leak out of the mitochondria. And as I've emphasized over and over and over again, free radical generation and free radical destruction drives premature aging to musculoskeletal structures such as bone, muscle, joint, and tendon. Resveratrol has many unique properties that allow it to combat or counteract some of the pathways that lead to premature aging of musculoskeletal structures. Resveratrol's chemical structure allows it both to accept and donate electrons without having a significant change in its overall stability. Now, this particular attribute is very important if you want something to be a potent antioxidant. The reason being is that free radicals are incredibly unstable because they have too many electrons or too few electrons. And so a substance like resveratrol can donate to a free radical that needs an electron and can also accept an electron from a free radical that needs to give one away. And if free radicals are more stable, they're less likely to attack healthy DNA, fats, or protein. Resveratrol also influences the synthesis of a protein called sirtuin, specifically sirtuin-1. Sirtuin-1 is an interesting protein that has broad influence on inflammation, oxidative stress, longevity, and mitochondrial function. The overall impact of sirtuin-1 is to promote a healthy inflammatory response, to minimize oxidative stress, and to boost the health of mitochondria. Resveratrol may support joint health. Turkish researchers evaluated the effect of resveratrol on a rabbit model of unhealthy knees. What they observed is that the group treated with resveratrol had less cartilage injury and had a greater production of essential proteins in the extracellular matrix of the cartilage that allowed for appropriate shock absorbing and strength properties. Resveratrol may enhance muscle health. American researchers evaluated the effect of resveratrol on a rat model of muscle injury. When applying the extract to rats that had calf injuries, they noted that the calf muscle had less oxidative stress when compared to a non-treatment group. Resveratrol may promote tendon health. British researchers evaluated the effect of resveratrol on injured human tendon cells. What they observed was that the group treated with resveratrol had a more healthy response to injury and less likelihood of chronic inflammation compared to the non-treatment group. Resveratrol may boost bone health. Danish researchers evaluated the effect of resveratrol supplementation on a group of men with metabolic syndrome. What they observed was that the treatment group had a higher spinal bone density compared to the non-treatment group, and they concluded that resveratrol may promote appropriate bone density and bone strength. Rich natural sources of resveratrol include red wine, red grapes, Itadori tea, and peanuts. Resveratrol from natural sources are generally well tolerated. With supplementation, if you're taking a dose of 1,000 milligrams or greater per day, there are known mild side effects to include GI disturbances such as diarrhea or an upset stomach. However, prior to consideration of any type of supplementation, please consult with a qualified health practitioner familiar with your unique medical history.